the one thing I really did want to address with you, which I think we've kind of covered here and there, is the juxtaposition of the public and private model.
Yes.
So now that you're here in it and you're solving problems in the United States, in our private system, weigh kind of the pros and cons of what you see having lived in some other systems as well.
Yeah, sure thing. So I think, I will draw parallels between, the three systems that I've lived and worked in heavily, which is the US, the United Kingdom, and New Zealand. And what I would say is there are a few key points to note. The first one is the United States size. So we're talking 300 million, I think, is the population here.
325, 50. Yeah. I mean, it's a huge number.
So there is the size of the country simply does not make it a good candidate for a fully publicly funded or tax funded system.
Okay.
For a number of reasons, bureaucracy being sort of the big one. But what I would say is also the private public mix allows for this ability to use legislation to sort of guard how a healthcare system is delivered, but then also to use the incentives around a privatized model to spur innovation and to create competition, which drives, I think, better quality and outcomes ultimately. The challenge for me that exists in the US healthcare system is around universal access. And so what I mean by that is the beauty of tax-funded systems is your ability to access healthcare isn't determined by how much you have to pay or your financial means to be able to afford care. In the United States, I think there are certainly public or government-funded programs to account for those that can't afford, but there is still a large group of the population who may not be able to afford the best care and therefore can't access healthcare. And so what's the ramifications? Well, we know that the stats are pretty alarming. I think it's 1 in 5 families don't have the savings in their bank accounts today to afford their total out-of-pocket costs. And so that's why you see some of the stats at a population level where the US model doesn't perform as well as other countries, which comes down to things like mortality rates, which is driven primarily due to access. And so the pros of the system, I think, really are about how you spur innovation. I mean, there's a reason why I came to the US to start a business, because I know for a fact, and I think it's globally known, that innovation is spurred by capital, which is spurred by private markets, which creates competition. And that is a very healthy environment to live in. But because of market failure with healthcare, which is to say, as consumers, we need healthcare and don't necessarily have the ability to choose when we need it, there needs to be a safety net, which sort of catches those people. Well,
and I think you kind of hit the nail on the head there, and brilliantly put. I didn't want to interrupt you because that'll probably be a clip. So what I would say, though, is the middle ground is really where the problem lives, right? You mentioned that there's a safety net for the people that functionally cannot afford it and live below certain income levels. And then the other end of the spectrum is people that absolutely can afford any type of care, and the premiums and the out-of-pocket expenses aren't even a factor in their decision-making process. Most people, though, live in that middle ground where they're functionally uninsured or underinsured. You mentioned 1 in 5 can't afford their out-of-pocket expenses. So some of us will go try to solve for that. Other people will just say, hey, well, let's layer in a cheaper way for you to borrow money for that gap, or let's do an HSA. And none of them are exactly solving the problem. They're just slapping a Band-Aid on that problem. But like you said, most people, I don't know what percentage of Americans, I'd be speculating, that would live in that middle ground where, yes, I have insurance, but I'm probably delaying care, or I'm not getting the care that's appropriate for me because I can't afford $500 or I can't afford $1,000. So I might actually be less healthy than both ends of both extreme ends of the spectrum, because I just didn't get the care I needed because I needed to go pay for college for my kid, or I needed to go pay for something else. And this just got set by the wayside. My own health got set by the wayside. And that is frustrating for me. And that is where I do believe our system fails.
Yes, and I would agree with that. I think where the US excels is the ability to provide individual choice. Right? So in New Zealand, for example, you cannot choose the specialist by name. You choose, if you need to see a specialist, you will be allocated to a specialty group.
Okay.
And the person that has the fastest availability will see you. Here you have the ability to choose a provider by name. And that is one of the luxuries of having the system we do. But you're 100% right. For those that sit, the majority of Americans who sit in that group or bracket that we described, they're the ones that I think suffer from the system that exists. And they're also our target market.
Yeah.
They're the people that we're ultimately focused on improving access and affordability.
Well, and that's like you said, though, the model then allows for the opportunity itself to exist to solve that problem. I always talked about this big picture, and I think we'll zoom out to kind of close the show out in the big picture of healthcare. But it's that problem is so infinite, or let's say the number of problems are so vast that there'll never not be an opportunity to solve one of them or solve it at a micro level. But the macro level, it's too complex to just paint a brush and now we've solved every problem, which is where entrepreneurs come in, where we collectively have to decide what things do well and what things don't. And then hopefully over time, we're at least steering the ship in the right direction, but it's going to take a very long time to get there. So why don't you